Good afternoon, everyone, and welcome to the Children's Inn at NIH Health Equity webinar. We are thrilled to have you join us today to discuss leadership and momentum in advancing health equity. I want to begin by thanking our presenting sponsors, Merck, Palantir, and Booz Allen, as well as our contributing sponsors, Deloitte and RTI International, and our many supporting sponsors for helping us make today's program possible. I'm honored to be joined by a panel of experts today, each of whom you will hear from shortly. Dr. Eliseo Pérez-Stable, Director of the National Institute on Minority Health and Health Disparities at the NIH, Dr. Shelli Avenevoli, Deputy Director for the National Institute of Mental Health, Dr. Victoria Ojeda, Professor of Public Health at the University of California, San Diego, Representative Robin Kelly, United States House of Representatives, and Cathy Morales, Chief Program and Services Officer at the Children's Inn at NIH. And I am Jennie Lucca, CEO at the Children's Inn at NIH. At the Children's Inn, our mission is to provide a supportive place like home, free of charge for children, young adults, and their families while they are participating in life-changing clinical research studies at the National Institutes of Health. Everything we do strives to reduce the burden of illness on families, make childhood possible, and help advance NIH medical research. The Inn is a key nonprofit partner to the NIH in moving pediatric medicine forward. The NIH relies on us for vital research infrastructure that supports young patients and their families' participation in critical clinical research. And we are dedicated to breaking down barriers to ensure that every child has access to the treatments and opportunities they need to thrive. One significant barrier we are addressing is the challenge of clinical trial participation. Clinical trials are critical for advancing medical research and developing new treatments, but participation rates, especially among underserved communities, have been historically low. That's why at the Children's Inn, we are working tirelessly to bridge this gap and make clinical trials more accessible to all families. The NIH conducts a wide range of clinical trials covering various medical conditions, including those related to mental health. By emphasizing the importance of clinical trial diversity and inclusion, we are not only advancing medical science, but also ensuring that all children, regardless of background or circumstance, have the opportunity to benefit from cutting-edge treatments and therapies. Today, we will dive deeper into these issues and explore how we can work together to promote health equity. Thank you for joining us on this important journey. Together, we can make a real difference in the lives of children and families everywhere. We will begin today's program hearing from Dr. Philipia Hillman, founder of the October Group and current Children's Inn board member, who we are honored to have serve as our moderator today. As part of the Inn's strategic plan, Philipia recently served as the co-chair of the Inn's Health Equity Task Force and has played a critical role in driving this initiative to ensure that health equity remains at the forefront of everything we do at the Inn. Philipia, it is such a pleasure to have you here with us today.
Thank you so much, Jennie, and I'm so honored to be here with you and an honored guest and all of our sponsors. Really excited because this is coming to the end of a 6-month journey where we had a very diverse input, hands-on experience about discovering and getting intentional about what we mean around health equity as it relates to the Children's Inn. In particular, while it's always been a part of the origin story, we wanted to step back and work together and say, what does it mean for us? So part of that journey was working with the task force, which included a diverse group of people across the board, working with the community, working with the NIH, working with people who are health advocates of equity, who practice that as part of their profession, but also as part of their giving, along with the families who we serve and the children who we really support. So today, this is a deeper dive in what we've done. One of the things we're really proud that we were able to produce is what we call our health equity promise that you can notice on our website. And it's our way of actively saying to our community, this is our belief and this is our promise, and here's our actions as it relates to health equity. So today, we really invite you to join us in this journey. So as you're listening to the panelists today, please use the chat to ask any questions you have. I want to encourage everybody. I used to be a college professor. All questions are good questions, so bring them on. Our panelists would love to hear them and address them. Also want you to get more in tune with and involved with what the Children's Inn is already doing. So later on, you'll hear from Cathy Morales about all the exciting things that we have planned and have thought about as it relates to health equity. So as we journey together today, again, ask questions, have an open mind, and join us on this journey. And again, submit your questions to the Zoom. And with that, I would like to invite our very first presenting sponsor, Merck, to introduce our first speaker. And thank you.
Thank you, Dr. Hillman. Merck is proud of our legacy of support for the Children's Inn since its very beginning and is honored to continue support for its life-changing mission. Merck's commitment to health equity is deeply ingrained in our core values as we actively address preventable disparities in disease burden and health outcomes to pursue equitable health care for all. It is my honor to introduce Dr. Eliseo Pérez-Stable, Director of the National Institute on Minority Health and Health Disparities, which seeks to advance the science of minority health and health disparities research. Dr. Pérez-Stable practiced general internal medicine and was a professor of medicine at the University of California, San Francisco, before moving to NIH in September 2015. His research interests include improving the health of racial and ethnic minorities and underserved populations, advancing patient-centered care, improving cross-cultural communication skills among clinicians, and promoting diversity in the biomedical research workforce. Welcome, Dr. Pérez-Stable.
Thank you so much, Dr. Clark, and I'm delighted to be here and share with you some highlights, updates from the National Institute on Minority Health and Health Disparities. And putting my slides up. So you heard about Ian. The last time we did a webinar with the Children's Inn, it was an introduction to NIMHD. So today I'm giving more of an update of developments in the recent times. First one outside of our arena is that the Office of Management and Budget and the Census recategorized racial and ethnic classifications in a recent statement or policy statement. This has been ongoing for at least a year, and you can see there's only going to be one question, so no more question about Hispanic, non-Hispanic. The categories are all familiar, except there's a new one, Middle Eastern and North African. And so this will be in the next census, and also we are now required to use this in all our federal work. In September of 2023, we declared that populations with health disparities, that population with disabilities is a health disparity population. I did this in consultation with the director of the Agency for Healthcare Research and Quality, Bob Valdez, and we published a notice of funding opportunity on research in people with disabilities shortly thereafter. And so we're really proud to have this responsibility moving forward for the whole NIH. This is not just NIMHD. Now, I want to highlight the Community Partnership to Advance Science for Society. This is a common fund program, not NIMHD, although we are very involved in leading it. And I would say that with the NIMH director, Dr. Josh Gordon, we are two of the 4 co-chairs. This is transformational in a way, in that this is the first time, to our knowledge, that NIH has directly funded community-based organizations. 25 awards were already made just late last year. We have a coordinating center. There are going to be academic hubs funded later this fiscal year. And 3 of the projects of the 25 projects are addressing mental health issues in youth in the locations of Miami, Puerto Rico, and Hawaii. Now, the other program just to update on is the Community Engagement Alliance, which is something that came out of the COVID pandemic in partnership with the National Heart, Lung, Blood Institute. SEAL, as we call it, started out on promoting clinical trial participation, get your vaccine, get tested, take medicine if you're positive for COVID-19, and has now expanded to include issues of maternal health, climate health, community engaged primary care research. We're in the process of working on setting that up, as well as special initiatives focused on American Indian, Alaska Natives, Native Hawaiians, and Pacific Islanders. We are collaborating with other institutes on these issues, particularly around maternal health and climate health, and we look forward to continuing to grow this community engaged infrastructure to not only do outreach and communication about science, but also to be a research network on addressing health disparities. Some sobering statistics in recent times. These are persistent sadness, and note this is pre-pandemic. Over a third of our youth have persistent sadness, which would be associated with then going on to develop clinically significant symptoms, and some variability by race, ethnicity, but not a lot. And even more concerning, around the time after the pandemic, from the High School Youth Risk Behavior Survey, 13% of female and almost 7% of male youth aged 14 to 18 had made a suicide attempt in the previous year. Now, with NIMH, we help sponsor this phenomenal contest. It's a national essay contest for high school students aged 16 to 18. We just recently reviewed the most recent submissions, and I read the 5 essays that will be rewarded. I will allow the staff to announce it when they're ready. They're just really wonderful examples of youth thinking about these issues, mostly from a lived experience perspective, I would say, but also addressing some concerns that are of great important national issues regarding our youth, particularly around issues around social media and isolation and loneliness. And so the 2019 and 2022 previous winners, they received cash awards. We call them gold, silver, and bronze winners, respectively, as well as honorable mention. And we're very proud of this collaboration, not just with NIMH, but also with the Commission Core Public Health Service, where this began. Now, just 3 quick examples of research grants that NIMHD has funded that relate to the topic of youth mental health. This is related to children with special needs, and it's more of a policy research project where it shows that Medicaid automatic enrollment via supplemental security income, so Social Security income, can help reduce disparities in insurance coverage. So you sign up for Social Security with a child with special needs, you automatically get put on Medicaid. This is again a project. Again, not presenting you with results, but I've heard Guillermo Prado, Willie Prado, as he's known, present on this very creative, innovative project to focus on family-based interventions with adolescents being at the core, but involving both siblings and parents. And the theme is to focus on HIV prevention. So they're not talking about HIV treatment or PrEP. At this stage, are really referring to sexual health, referring to having knowledge about substance use, depression. So it's a conglomerate of behavioral interventions at this very vulnerable and susceptible age. The name in Spanish is Familias con Orgullo, or families with pride. And having become familiar with this project, I must say I'm very optimistic that they will have positive results. And finally, importance with our indigenous populations to really make a foundation in the culture and tradition of our indigenous people. After everything that has happened to American Indian, Alaska Natives in our history, I think this is a correct and appropriate way to approach this. So this also involves this family involves a family listening program and prevention for 4th and 5th graders, and implementing this program with different tribes. So just want to end by emphasizing what the NIMHD mission is about. We lead scientific research to improve minority health, reduce health disparities, and promote health equity. And we're reducing health disparities in all people in this country and its territories, but also especially in populations that have been designated to have health disparities. And we do envision a future of America where everyone has equal opportunity to live long, healthy, and productive life and enjoy health equity. Thank you very much.
Thank you so much, Dr. Pérez-Stable. That was beautiful. The things that I heard, right now we're hearing in our society such a difference between we're no longer paying attention to these things. They've become back burners. And what I'm hearing is you are forging ahead on both levels. What I loved about it was both the macro of what you're studying around social media, which impacts us all, adults and the children that we buy these devices for, down to our micro behaviors. And even the language, the inviting language of what you're studying around community engaged science, policy engaged science, family engaged science, this idea of research being titled Families with Pride made me smile, right? It made me know that we are truly becoming inclusive, even with our day-to-day language with that. So we are very grateful and very excited to continue to stay connected with you and watch as you continue to forge ahead on making sure that we all have a future of health. So thank you very much and appreciate that. And with that, I'm going to presenting sponsor Palantir introduce our next panelist. Thank you so much.
Thank you, Dr. Hillman. Hi, I'm Haley Fox and I work at Palantir. We at Palantir are truly honored to be a part of this event and to be able to support the Children's Inn and its life-changing mission. And we are really looking forward to continuing our support through our sponsorship and attendance at the upcoming Children's Inn Gala. It is my honor to introduce Dr. Shelli Avenevoli, the Deputy Director for the National Institute of Mental Health, where she has served in various capacities for more than 22 years. She has contributed significantly to numerous large-scale NIMH, NIH, and trans-agency efforts on youth mental health and suicide prevention. As Deputy Director, she oversees NIMH's research portfolio, covering the full range of the scientific continuum and breadth of mental disorders. NIMH is the lead federal agency for research on mental illnesses and seeks to transform the understanding and treatment of mental illnesses through basic and clinical research, paving the way for prevention, recovery, and cure. Welcome, Dr. Avenevoli.
Thank you so much. It's thanks a lot, Haley. It's really my pleasure to be here. So good afternoon, everyone. The last time I was here was to present to you updates on the impact of the pandemic on youth mental health, and I'm really pleased to be here today, moving out of the pandemic and focusing now on advancing health equity across our portfolio. So next slide, please. So I actually like to start with our mission, and Haley did me the favor of reading that to you. It really sets the stage for our entire research agenda, and all of our work in health equity is driven by this mission. And I'll just add to that, over the past 75 years, NIMH has supported research that's played a pivotal role in understanding our understanding of the brain, of developing groundbreaking treatments and improving the quality and availability of mental health care for all. These successes are not ours alone, and they are shared, obviously, with the greater research community, with our sister NIH institutes and centers, and with many of our other external stakeholders, many of whom are on the phone, and that very much includes the Children's Inn. The important point here is it really takes a village to do this important work. Next slide. And today I know we're focusing on youth and health equity, but I wanted to start with the recognition that we are really in the midst of a youth mental health crisis, and our youth are struggling and suffering. This was brought to the attention of the nation through the recent advisory from the US Surgeon General. But as Eliseo and others have noted, these problems existed long before the COVID-19 pandemic. Mental health challenges before were the leading cause of disability and poor outcomes in young people. And the pandemic only served to exacerbate the challenges we were already facing. Eliseo mentioned increasing rates of mental illness and increasing suicide rates, as well as challenges in accessing specialty mental health care for those who need it, and the ever-growing health disparities and inequities that follow from all of those things. Next slide, please. So today I want to focus on some of the ways that NIMH, in partnership with other NIH institutes and centers, have worked to address youth mental health broadly, but health inequities in several different ways. So one example is a recent partnership with the National Institute of Minority Health and Health Disparities and the Eunice Kennedy Shriver National Institute of Child Health and Human Development. We work together with other important stakeholders and partners to develop the 2023 strategic framework for addressing youth mental health disparities. And this document is located on our website, and it summarizes our priorities for guiding research to address and reduce mental health disparities among underserved and underrepresented youth, with a goal of achieving these aims by 2031. And there are 3 components. One of those components does focus on research opportunities, but there's another component focused on enhancing stakeholder engagement, and a third component focused on growing the youth mental health disparities research workforce. Next slide, please. Another important area in which we are investing to eliminate mental health disparities is in suicide prevention. Eliseo mentioned these increasing rates. The rates of suicide increased between 2007 and 2019 by 57%. And it's not surprising that there are significant disparities in rates of suicide across racial and ethnic groups, and also between LGBTQ+ youth and their heterosexual counterparts. So to better understand these disparities and how to address them through research, NIMH has held a number of roundtables, workshops, and webinars held in conjunction with partners like NIMHD and NICHD and other NIH institutes. And the idea is that by bringing the relevant people to the table, we're better able to inform our research agenda. What are the important questions we need to address? What are the challenges with the research we're facing? And these discussions, importantly, have resulted in several funding opportunity announcements that have allowed us to support research on things like risk detection and intervention development in youth from underserved populations. The ones listed here are just a few. I mean, there are really countless numbers of opportunities we've been able to put out in the last few years. Next slide. Another important area of recent research Eliseo also mentioned is really about understanding both the positive and negative impacts of social media or digital media and technology use more broadly on youth development and mental health. You probably all know that this issue has received a lot of attention from the White House, Congress, and the US Surgeon General, as well as highlighted in this recent advisory. Next slide. And NIMH is working hard, particularly with NICHD, to heed this call and try to address this issue. We are already supporting research to understand, as I mentioned, the positive and negative impacts of social media on adolescent health. But we've also recently hosted a workshop with NICHD to further develop this research agenda. We're trying to bring more of the relevant partners to the table to, again, understand what are the challenges and how can we collaborate in a meaningful way to address these issues. Next slide, please. Another important trans-NIH effort is the Adolescent Brain and Cognitive Development Study. This is actually the largest long-term study of brain development and child health in the United States. And it's led by the National Institute of Drug Abuse in partnership with NIMHD, with NIMH and several other NIH institutes and centers, as well as other government agencies as well. I think it's important to note that this question is large enough that it can start to help us understand some of the health disparities and help us to start to address some of the health inequities in mental health and substance use disorders. And I just wanted to highlight that this study has what's called the Justice, Equity, Diversity, and Inclusion Advisory Council, which really works with the study investigators to ensure that the research and the data are used and interpreted with the utmost integrity and in a way that prevents further stigmatization, marginalization, and injustice to the individuals. Next slide, please. And my last part about some of the things that we're doing focuses on our collaborations with the Children's Inn. As some of you may or may not know, NIMH conducts clinical trials in the NIH Clinical Center. The slide I've included here is really just one example of many of the kinds of clinical trials that we do on the campus. And I want to just note that the Children's Inn has really been an outstanding resource for our NIMH investigators who study children to ensure that children and families are able to participate in our research. And of course, it's been a valuable resource to the actual children and families who do come and participate. We do regularly hear from families that the Children's Inn is an amazing supportive home away from home. And I just want to acknowledge and say we really appreciate this partnership and look forward to working with them to further enhance inclusion in our clinical trials at NIMH. Next slide. And I just wanted to end on kind of a celebratory note. NIMH is celebrating our 75th anniversary this year. This is one example of NIMH-supported research that's improved care for children with mental illnesses. This one focuses specifically on treatment of ADHD, and it highlights what investment in research can do, what participation in research can do, and really inform clinical care. So now we really understand what is standard care for children who come to us with ADHD. And I want to invite you to check out our website. We have many more important successes shared on our website, and I encourage you to take a look. And finally, I just want to say thank you all so much for being part of this research endeavor. We appreciate these partnerships and acknowledge that we couldn't do our work without them. So thanks for having me today. I think you're on mute, Dr. Hillman.
Yes, I was. Thank you for that. I so appreciate the dynamic you're creating of a source of tension, being that social media, digital technology, as a potential source of solution, and bringing together partnerships of that tension, because it's the answer is it within that tension. So thank you so much for hearing that, along with letting us truly understand about the tender care and responsibility we do with the data around partnering with justice, equity, diversity, and inclusion. It's one thing to have data, and it's another thing, what do we do with it to serve the communities that we are trying to support and bring into health, along with just continued stakeholder involvement, including our ongoing partnership with the NIH, making a home away from home. It is a beautiful and ongoing partnership. So thank you so much for being in journey with us. Really appreciate it. And with that, I will have our final presenting sponsor, Booz Allen, introduce our next speaker.
Yeah, thank you, Dr. Hillman, and good afternoon, everyone. Booz Allen has been an invaluable partner to this Children's Inn at the NIH, providing a wide range of pro bono consulting services essential to the Inn's daily operations, including conducting a building assessment, creating a customized resident management solution, raising money for its marquee events, engaging our leadership and staff in regularly serving meals and coordinating holiday festivities, and much more. Booz Allen advances the nation's most critical civil, defense, and national security priorities by integrating tomorrow's innovative technologies in AI, cybersecurity, and leading-edge engineering with an enduring focus to transform our clients' most complex missions while empowering our diverse talent to change the world. It is my honor to introduce Dr. Victoria Ojeda, Professor of Public Health at the University of California, San Diego. While at UCSD, Dr. Ojeda's research has been focused on improving the use of health and mental health care services among young adults and persons living with serious mental illness. Dr. Ojeda is no stranger to the NIH and NIMHD, recently working on a grant titled Impact of Peer Support on Health Service and Social Disparities Among Minority Youth with SMI as the principal investigator. She also led the Rethink program, which sought to improve healthcare access, including the use of mental health services among racial and ethnic minority young adults on probation. Welcome, Dr. Ojeda.
Great, good afternoon. It's so nice to join you today, and it's an honor to be part of this distinguished panel. I really appreciate the invitation from the Children's Inn and Dr. Pérez-Stable to join you. I'd like to share a little bit of some of highlights from our health equity focused research, where we've looked at effective interventions to improve mental health access for young adults that I've carried out in collaboration with young adults and our partners in the community and other researchers. And as was mentioned, our work has been supported by the National Institute of Minority Health and Health Disparities. And for the last 16 years or so, I've been interested in understanding how individuals connect with mental health services and trying to find interventions that will help them overcome barriers, both financial, logistical, and cultural, to accessing these important services. And during this time, what we've seen is that the consumer voice has really been a key component of helping to include individuals with lived experience into mental health service teams. We have come to know these individuals as peer providers. And what they do is they use their experience to inspire hope in their clients. They're able to serve as role models, and they can help their clients build skills, knowledge, and the self-esteem needed to overcome mental health stigma, so that they can continue carrying out activities that will help them achieve their personal goals. I think it's important to note that across the US, some states have responded with policies to reimburse peer providers for their supports. And these policies are also seeking to further define the scope of practice for the peer support role. In other words, what they do on a day-to-day basis. And so our team recently examined the impact of peer support specialists on mental health service utilization among minority young adults living in San Diego County and Los Angeles County. And we were really interested in this topic because we know that young adults face quite significant challenges to accessing mental health care because of their age, because of financial and logistical barriers, in terms of having health insurance coverage, finding the right source of care, and also just where they are in their trajectory as young adults. Some of them may not have necessarily acquired all the skills needed to really overcome these barriers. But as I mentioned, peer support has really been an important component of mental health services, and is becoming increasingly available for young adults as well. So we wanted to understand if this service could help them overcome these barriers so that they could engage more regularly with mental health care. And we have seen a lot of disparities among minority youth in being able to access these services. And what we found was really quite encouraging. So when we looked at programs that offered peer support services, we saw a reduction in disparities in service utilization among both Black and Latinx youth in Los Angeles County, for example. And we also saw that youth that had access to peer providers who were also youth received a greater number of services, which resulted in greater number of outpatient visits. And this is an encouraging result and important because it suggests that having access to peer support services can be helpful for young adults that are living with serious mental illness to remain in the community, and that they can engage with all of the activities that they're interested in doing, including their education, vocational goals. We witnessed some young adults that were engaging with the arts as part of their recovery. So I'd like to share, for example, some of the participants' own words about how the peers were impacting their own experiences. So this is a quote from one of our youth that participated in a focus group. They mentioned, peers provided a lot of things for me, which I never knew there's stuff like that that's provided. Because if it wasn't for them, my life would be much worse. And they make sure that where I stay is comfortable for me, and they provide enough food and services that I needed. My therapist, well, I didn't have a therapist for a while, but now I do. And it's okay because there's a service pretty often, and they make sure that you get there on time. And sometimes they even pick you up. And we also know that through our work that peer support services are a culturally competent way of providing cost-effective care in the community, and particularly when youth are serving youth. And so we heard this as a resounding theme, was that youth are able to connect with other youth in a way that some of the other staff, and including the clinical staff, are not, by virtue of having a shared culture, a shared language, from living in that same time and space. So another example of how the peers impacted the clients. So one youth noted, the fact that I feel like she, my peer, knows where I'm coming from. I'm not saying anything bad about my therapist, but they just have this feeling that they might not know completely what I'm going through. But I feel like my peer basically knows where I'm coming from. She's in my scene now. Like the therapist, I feel like they have not power over me, but coming from more from a spectator look. So what we're seeing is that this field is really continuing to develop. And with respect to the youth peer providers, we do have additional questions, I think, that merit further exploration. So for example, there are questions about how the peer support role fits within young adults' career trajectories. It's unclear whether the training and on-the-job learning that they're receiving is going to enable them to remain within behavioral health services, and the additional types of support that they will need to be able to do so, or even if they would like to do so. One of the things that we've heard from the peer providers themselves was that they're not sure, because oftentimes the peer provider role is considered an entry-level job with entry-level salaries. And it is a quite complex role that requires much from the peer providers in terms of their emotional work, the hard skills and soft skills that they need to employ to navigate between the clients that they're serving, as well as their colleagues in the mental health service teams that they're working with. There's also additional concerns and interest in understanding best practices for integrating peer providers into clinical teams. And this is important because the peers are often working in multidisciplinary teams that have social hierarchies because of the colleagues that they're working with in terms of academic credentials. The teams may include social workers, psychologists, case managers, and so forth. And so again, peers are often the frontline staff that have a clear view of the client experience, and some of the programs that we spoke with are really trying to find innovative ways to make sure that that peer voice is really given a prominent role in service delivery and team meetings to really benefit the clients the most as they can. And I think with NIMHD's support, I'd like to just mention too that we're now implementing an intervention that we're hoping to reduce disparities in access to physical and mental health care among minority adults, including young adults that are exiting the carceral system. And so we are implementing some of the best practices and lessons learned from the work that I previously mentioned and that of our colleagues, so that we can ensure that our peer providers have the supports and resources they need to serve the young adults that are emerging from incarceration. And that's important because our peers often have trauma and some mental health challenges that impact their own well-being, while they're also serving adults that are also working towards recovery with their mental well-being. I would say it's heartening to say that the field of mental health services is really making a clear impact on the health and well-being and also structure of service delivery models for other populations. In fact, what we're seeing is that engaging peer providers is also being considered as a best practice for reentry services, which is the services that are provided to adults exiting the criminal justice system. And there is a growing recognition that peers offer this unique and critical service to community members who are facing substantial challenges in navigating complex healthcare systems. And one of the things that we heard from one of our clients was they noted that I feel more confident in myself in achieving more things in life. I really appreciate the staff here. This was a very helpful program, and I can say that I've picked up many life skills I've never been taught in my life. And again, we're talking about community members that have had significant disadvantages in their communities, and so therefore the peers really are able to present information and help them connect to resources in a very productive way. And to also, as I would say, address the social determinants of health so they can achieve their personal goals. And one of the participants noted, my mind and focus is better concentrated on goals that I've set for myself. I have a clear plan for my future, and health is important. So in closing, I just would like to let you know that I really do feel privileged to know that our work is contributing to advancing health equity and also helping to our understanding of the field of how peer support services work and how we can strengthen supports for the peers doing this really important work as they support young adults living with serious mental illness. Our results indicate that peers are really having quite a significant impact on also helping formerly incarcerated young adults return to their communities as they pursue work, jobs, relationships, and parenting. And I would like to thank y'all for your time, and to our community partners. We really couldn't do it without you, to NIH and NIMHD as well. We are grateful for the support, and we look forward to our continued collaboration. Thank you.
Dr. Ojeda, thank you so much for that. Really appreciate what I'm hearing a common theme about honoring lived experiences as part of the science journey, as part of understanding what's happening. And when we think about the idea of young adults here in the United States, we push them to be so adult so soon, and maybe too soon. And what I'm hearing from you is there is an opportunity for them to rely on one another as a source for health, including this idea about, because you look like me, I can believe it. And as we know, there's this saying, if I can't see it, can I really be it? And seeing other people with the same lived experience moving towards health and living a healthy lifestyle, we can see from your work, it's giving us hope that within your own community, within your own age group, within your own resiliency, that's possible. And we see that again as what we are working hard to do at the Children's Inn, again, providing that home away from home, seeing people like you in a setting where you grow. So absolutely see the partnership in that. And one last thing I'd love that you said, that all of us as both parents and older adults sometimes is this spectator look. Even in our attempt to be helping and offering support, are we showing up as a spectator? Or are we really showing up as someone there with support? So beautiful. Thank you so much. With that, I'm going to introduce our contributing sponsor from Deloitte.
Thank you so much, Dr. Hillman. Good afternoon, everyone. My name is Ashton Asbury, and I'm a senior manager within Deloitte Consulting's Federal Health Practice. And it has been one of the privileges of my life to support the Children's Inn for the last 5 years as part of Deloitte's decades-long relationship with the Inn. We've had the opportunity to participate in the recent Health Equity Task Force that Dr. Hillman referenced earlier on the call, as well as supporting DEI programming. And I know we're all very excited about the upcoming Gala Evening for Hope that Deloitte also sponsors. And through my work with the Inn, I've gotten the chance to get to know Cathy Morales, and it's my honor to introduce her today to you. Cathy is the Chief Program and Services Officer at the Children's Inn. She's a pivotal part of the Inn, sharing her knowledge and expertise in program and project development, stakeholder engagement, and experience in nonprofit management. Before joining the Inn, Cathy served as the National Program Director for the National Reach Coalition, developing and implementing the organizational and programmatic goals of the organization. As you can see, Cathy is a truly committed public health professional and, dare I say, wonderful human being. So welcome, Cathy. We're so excited to hear from you today.
Thank you, Ashton, and good afternoon. It is my pleasure to share with you the important role the Inn plays in furthering health equity for pediatric patients and their families who participate in clinical trials at the NIH. As Philipia shared, in the fall of 2023, the Inn adopted the statement you see on the screen to recognize and highlight our role in ensuring that health equity has always been and will continue to be at the forefront of all we do to support the families who stay with us. At the Inn, health equity is woven into the fabric of our community. We acknowledge that every family is different and may require different supports to be successful. This is integrated into the programs and services we provide, which range from no-cost lodging, access to daily meals, and a variety of educational, wellness, and recreational activities led by our staff. Our ability to adapt our services to meet each family's needs is a key strength of the Inn, and one that not only makes us unique, it also brings our health equity commitment to life. With our NIH partners, we work to create an interconnected system that strengthens the relationships we build with our families. Our goal is to reduce the stress and burden of having a sick child, so we focus on getting to know our families, listening to their hopes and concerns, recognizing that they come to us from diverse cultures and lifestyles, with beliefs shaped by the experiences they have encountered in their lives. That is, we want to determine the obstacles or challenges any family may be experiencing and implement resolutions guided by their input. An example of this is our support of patients with sickle cell disease. Many of them come to us as teens or young adults, and as you've heard the previous speaker, this is exactly in line with what she was talking about. They've grown up in medical systems where they have not been believed when experiencing severe pain crises. This repeated treatment leads to a distrust in the healthcare system and a feeling of stigmatization. We work to understand this at the end by getting to know them and understanding the impact of their experience. Our staff works closely with them to find ways to engage them in life at the Inn, including the development of a buddy system where they have opportunities to connect with others in their cohort. We found that this has helped them find their voice, and so they now provide us regularly input on the programs being developed for them, assuring alignment with their cultural and social norms. Another approach we employ is through our clinical partners at NIH, who we have worked with closely since our founding in 1990 to support families once they arrived on campus. Using a health equity lens, we have now established a new program to engage with research teams while they are in the process of finalizing and preparing to launch their trials. This allows us to learn about the conditions being addressed, as well as any accommodations for cultural or language differences, physical or psychosocial supports needed for the patients. We're then better equipped to establish resources for these families before they arrive on campus, thus allowing them to fully focus on their child's health from the get-go with a goal of achieving optimal outcomes. While this process usually takes a few weeks of planning, we recently had a situation where we only had a couple of days to prepare for a new patient who needed immediate medical attention, was already traveling to the Inn from abroad. Inn staff worked very quickly with the medical team to prepare as best we could in a short space of time, identifying family needs for translation services and dietary requirements. Upon arrival, the staff worked with the family to make them feel at home, including connecting them with other families from the same region for additional support and community. By working with patients in this way, we strengthen the environment of trust and psychological safety at the Inn. So as we focus today on health equity in relation to mental health, I also want to share an example of how we meet this need for families. As you heard earlier from Dr. Avenevoli, for many years we have worked with clinicians from the National Institute of Mental Health in the support of pediatric patients, both those enrolled in mental health trials and those who may require support to navigate their clinical trial journey. We do appreciate our partnership with NIMH, and we do look forward to future endeavors. For our families, being in a different environment away from home and support networks can intensify a caregiver's stress level, which may impact their ability to successfully support their child. As an example, last fall, we became aware of tensions between several families, which were exacerbated by cultural and language differences, as well as different perspectives on parenting. Working with our partners at the National Cancer Institute and the National Institute of Mental Health, we established two new programs, the Kindness Club for children and the Coping Corner for the caregivers. The objective for each group is the same: open dialogue in a safe space in an effort to build community among the families. While the children learn about friendship, being open and accepting of one another, their caregivers have the opportunity to talk about their concern for their child's health and the challenges of being so far from home. And we find that often they find that despite their perceived differences, their worries and concerns are the same. So these are really only an example, only a snapshot really, of our work to ensure equitable support for our families. True to our health equity promise, we recognize and address the unique needs and challenges faced by patients and families, thereby playing a vital role in fostering mental health and overall well-being across the INS community. Thank you for the opportunity to be here this afternoon, and now I'll turn it back over to Philipia.
Thank you so much, Cathy. And we keep hearing this dynamic between the micro and the macro, as we talked about, right? And people coming from different languages, different cultural backgrounds, different expectations around socio-emotional. At this micro level, they come with their luggage, with their lives and what they've been living. But through our partnership across the NIH campus with the care of the children's, and we're able to bring it right down to the micro, and even the idea of the Kindness Club, which is an individual giving. How do we come together, or having the caregivers come together and talk about care? Because in the end, they're all there for the same reason, the health of their children. And how do we navigate to that to get to that? So I love that. The other thing I was thinking about this term, as you were saying, the tensions, and it could be so simple as kids being kids. And I want to share this. I would often tell my children, they would see food they didn't recognize and yuck, and I was like, don't yuck their yum. Don't you yuck their yum. And it could have been that simple. They hadn't smelled that before, tasted that before. But again, coming together to have a conversation around the sacredness of something as common as food, particularly in a health setting, is so important. So again, as we know, NIH, and particularly on the children's end, has always been part of their origin story, health equity, and through our work, getting even more intentional around bringing, as you said, the psychological safety with that. So thank you so much, Cathy. I appreciate that. And with that, I would like to introduce our last contributing sponsor from RTI International.
Hello, thank you, Dr. Hillman. I'm Megan Comfort, and I'm representing RTI International, which is an independent nonprofit research institute dedicated to improving the human condition. RTI is honored to be able to support the NIH and the IN through this webinar and other events, uniting in our shared commitment to turn practice into impact through research that leverages power, influence, and resources to advance equity. I'm delighted to introduce Congresswoman Robin Kelly from the 2nd District of Illinois. Representative Kelly is a member of the House Energy and Commerce Committee and serves on the Health, Communications, and Technology and the Innovation, Data, and Commerce subcommittees. Her energy and commerce work is focused on expanding access to healthcare, consumer protection for American families, and economic development. Committed to improving the health and wellness of vulnerable communities across the country, the Congresswoman also serves as chair of the Congressional Black Caucus Health Brain Trust and co-chairs the Congressional Caucus on Black Women and Girls. She also co-chairs the House Democratic Policy Group and House Tech Accountability Caucus. Welcome, Congresswoman Kelly.
Hello, everyone. I'm Congresswoman Robin Kelly, and I've been proud to represent the 2nd Congressional District of Illinois for 11 years. As chair of the Congressional Black Caucus Health Brain Trust, I'm proud to join the NIH for today's important discussion. I'm so grateful for the efforts of Dr. Eliseo Pérez-Stable, Director of the National Institute on Minority Health Disparities, for the work he and his team are doing to advance health equity. In a world where access to quality healthcare remains uneven and unjust, our commitment to health equity is central to building a healthcare system that works for everyone. Barriers to care are not just inconvenient, they perpetuate cycles of inequality that impact all of us. My district here in Illinois is urban, suburban, and rural. But no matter where I go, I hear concerns about access to health care. And the NIH is a critical partner in my efforts to ensure that every one of my constituents can access the affordable, high-quality health care that they need. I will continue to work across the aisle to ensure that the NIH remains a global leader in public health research. To that end, I'm proud to lead the NIH Clinical Trial Diversity Act to build on current efforts at the NIH to improve outcomes for historically marginalized populations. This legislation would support the NIH and community organizations in their efforts to recruit participants that actually reflect the population that will need treatment. The legislation will also improve data collection practices to make sure trials are meeting diversity goals. And it's not just clinical trials. Our healthcare workforce must also reflect the diversity of our communities. We need young leaders from all backgrounds to tackle the public health challenges of today and tomorrow. Whether it is a once-in-a-century pandemic, a rare form of cancer, or the crisis of Black maternal mortality, any effective treatment requires trust. To build that trust, we must ensure that our medical system is built with equity and justice at the forefront. Health equity is not just a nice idea. It is an essential component to building the best possible healthcare to every American. I'm glad to be with you in this fight, and I look forward to speaking to you again soon. Thank you.
We want to thank Congressman Kelly, not only for her commitment, but her ongoing and evident concern around health. And what I appreciate is, again, at the Children's Inn, our ongoing partnership across Congress to make sure that it is part of just the national dialogue around health equity, and particularly for our children. And as she said, it's not suburban, it's not urban, it's not rural. And as we know, it doesn't have boundaries. Health equity is for us all. With that, I would like to thank all of our speakers and all of both the care and the focus and the rigor you are bringing to different conversations that we're having across. I encourage everyone to please use the chat. We invite you to not allow you to be spectators, but allow you to join in this journey and ask questions. So encourage you to do that. And what I'd like to do is help jumpstart the conversation. And this is for all the panelists who joined us. You know, we are seeing, as you said, just this epidemic of mental health across our young people and our young adults. In particular, noticing the surprise difference between females and males, and just wondering if you could each take a second and speak on what you think that contributor is, the disparity between both females and males. Would love to hear that.
You want me to jump in first, Eliseo? Yep.
Yes.
Okay. It really depends on the mental health problem or mental disorder that you're referring to. Some of them are more prevalent in females. That tends to be things like depression, major depression. Others are more prominent in males, and that changes across the life course. So sometimes when in childhood, the problems are, have fairly equal prevalence, but as you move into adolescence, you start to see those gender disparities at that time. And I would say that even though there are disparities in rates, so for example, autism is more common in boys, depression more common in girls, we struggle for all kids of all genders in finding the quality care that they need to address the issues.
Thank you for that. Eliseo, did you have a?
Yeah, just to highlight that, it's observations, right? And that really informs what we do, both intervention-wise, clinically, as well as policy-wise. So these are important categories to look at. We didn't mention today, but for example, LGBTQ plus youth do tend to have greater rates of both depression and suicidal thoughts, and they're particularly potentially more vulnerable. I think that immigrant youth is another category that we have seen sort of torn between the different dynamics that they're living in with parents and the new society they're surviving in. And these things don't always translate to the same things in adults. Where, you know, males are much more successful, for example, at completing suicide, even though they have fewer attempts. And that mostly relates to the vehicle using firearms, and that's in adults and older adults. We don't, so everything that happens in youth and adolescence doesn't necessarily always continue onward. But I think that these factors are really important. So.
Thank you for that. Cathy, I'm curious with your relationship with the Children's Inn, are you seeing any differences between males and females and in relationship to their mental health?
Actually, we see a lot more of the males tending to be loners. They stick, you know, they prefer to be on their own with their device. And that's so we really work to get them out of their shell. And that's where the whole buddy system came about, really trying to engage them. We find that our young ladies, our teens and young adults are far more likely to join in and participate in activities, where with the males, we do struggle a little bit.
Yeah, to pull them in, absolutely. Dr. Ojeda, I wonder what's top of mind for you.
Sure. No, I think, you know, at least in the studies that we've done looking at, for example, National Survey on Drug Use and Health, you do see service utilization disparities by gender. And I think it is a challenge. And I think, again, bringing in young adult males into the service teams, which can be hard to do. But I think, you know, again, having those folks that our clients can identify with, our participants can identify with. One of the things that we were really astounded by too has been the fact that when we've been providing all of our intervention as a one-on-one modality, that has made a huge difference in the young men being willing to disclose, being willing to participate in activities that I think open the conversation to engagement in mental health services, right? So having that safe space in a one-on-one setting that's more confidential, where we can now bridge, you know, the topic, and start gaining that self-awareness so that they're more open to having mental health service utilization. Whereas I would contrast that to some of the interventions that are very much group setting, which is cost effective. But again, some of the men that we work with that are justice involved, for example, they're used to having those walls up and kind of not disclosing as much. And that's where I think there's a real value in some of this one-on-one work. And we've seen a lot of success there.
Thank you for that. And what I'm appreciating across the four of you is I think sometimes we forget this context matters. Your sexuality, are you a firstborn immigrant? Are you physically healthy? Where are you? So all of this context matters. And particularly for young adults, that context becomes their identity in a very different way than as you mature. So that's very, very thoughtful about that. Curious about both Cathy and Victoria. You mentioned some things we could do. What are some other things families can do in support of their children's mental health?
Sorry, it muted me. Well, I think, you know, one of the things that we're working on is trying to build, I apologize if there's noise, build communication skills in our young adults. And sometimes what we're trying to do is invite the parents to work on those skills either alongside their youth or separately from their youth. And I think having programs that, again, we're just testing this model to see whether kind of, you know, bringing the immediate family into the intervention can be helpful, because what we were seeing is that we're creating in some respects within household disparities by only saying limiting the service to the youth or only to the adult, but not considering the fact that, again, you know, kind of from the social ecological model perspective, right, the kids are interacting with the parents, their siblings, and so forth. So we wanted to bring everyone up together, and this is a model that we're testing, and we'll just see how it goes. But I think communication skills, I think, is a big part of that process.
Thank you. Eliseo, Shelli, any thoughts on that?
Well, I want to reiterate what Victoria said about, family-centered. You can keep extending the context to community engagement or organizations, people that gather around, whether it be faith-based organization or sports related or service related or other organizations. And I think that there's an inherent value in going beyond targeting individuals, which has been the mindset or the sort of the format of research for the most part, focused on individuals or big ones on populations. And I think the idea that we should leverage these units, these organic social units, I think for advancing health, I think really important. And there is evidence in family-based or family-grounded interventions in a variety of settings, including therapy. So,
yeah, absolutely.
And just to build on the family component, I mean, there are some things that might sound sort of obvious, but it's important for parents to lead by example, show good, mental healthy behaviors, but also know what are the signs of distress in your kids and pay attention and be a good listener and, know where to connect them to care as needed. And your pediatrician is one, obvious place to start. And I think the idea of engaging kids in the activities they value is really powerful. And I think of that around the social media subject. This is why we're interested. And Philippa, you mentioned this. This is why we're interested in understanding both the positive and negative benefits. It's not something that's going to go away. So how can we leverage this thing that our youth are so fully engaged in a powerful way to make to help them and engage them appropriately?
Absolutely. Use it in service of themselves, right? In a healthy way. I'm going to take this question from the chat, and the question is, what is your thoughts on the use of decentralized clinical trial approach? What's your thoughts on that? And that is from the chat.
Well, I'll jump in first. You got to start by defining what we mean by decentralized, since most, big clinical trials use often 30, 40, or 50 recruitment sites, and that seems pretty decentralized to me, although it's coordinated. I'm thinking of the Moderna vaccine trial that was a mandate, an emergency. There were 55 CROs plus, and the national NIH had 27 separate recruitment studies. That's a massive effort to do something in a matter of literally a few months, versus a small clinical trial where you're trying to identify a specific factor where you may only use one place or two places. So I don't. Now, the notion of saying, well, every clinical encounter should be susceptible to clinical research, and there could be a number of studies, clinical trials, where people are receiving different kinds of interventions. And that would require infrastructure and organization to be able to do that. And that's sort of an empirical approach, pragmatic studies, combined with clinical outcomes that are collected at least systematically, and that we have a baseline information on everybody. That, I think, is something NIH is moving towards in gradual steps. Perhaps our new Dr. Bertagnoli will lead us down that path. At least I think she has expressed interest in that. So,
thank you for that. Curious if others have perspective. I love your non-silence. Perfect. There's a question in the chat about just as we're thinking about mental health, mental wellness, and ongoing impacts around COVID. Is there any other, particularly around COVID, the loss of COVID, the impact of COVID, that families should be doing differently in relationship to that? And that is a question from the chat.
I would say one of the things, I was very hopeful that the fact that mental health got so much more attention during the pandemic that we could all grasp that and take advantage of that attention, the idea that we might put resources, into addressing these issues at all levels of our society, at government levels, within schools. And I think being an advocate for parents to be advocates about how those pieces need to be integrated, in all of these various places that their child interacts with, I think is important. We're trying to do that at the NIMH level. We're trying to take advantage of the attention, on mental health. We've created some initiatives. We're calling it the Mission for Mental Health, and we've presented that publicly before, kind of focusing on the areas where we can try to leverage what we've learned from the pandemic, to try to improve health, and particularly among our youth who are struggling the most.
Any other thoughts?
I would say that a big lesson for me is, how much we need to pay attention to structural factors, because I see a lot of the consequences, particularly for youth, different sets of issues for adults, of the COVID effects, where isolation, schools were shut, children were shut out of their normal social environment outside the home, parents were struggling. And we had at least 1 year lost to a whole cohort of children who didn't have the advantage of being able to maintain their learning from home because their parents were busy, or they didn't have a computer, they weren't able to focus as much. And this cuts across all groups, but really mostly impacts people who come from low-income families of all populations. So I think that knowing what happened from something like this should give us the ability to say, well, we need to invest more in some infrastructure like access to internet, since we know we can do this virtually, but people have to have the equipment and the Wi-Fi to be able to do this. So that's one thing I would emphasize.
Thank you for that. And honoring time and honoring that we are talking about mental health, and want to end on a high note, just really quickly from everybody. What is your highest hope as we're looking at mental health with you in the youth? Just really quickly, one high hope.
Prevention of lifelong problems.
Thank you.
I
agree.
Go ahead.
Agreed.
She's agreeing, prevention.
Yeah, I would like to think that getting more interaction people to people as an intervention in young, whether it be parents with children or other adults with children and children among themselves in healthy activities, would be a thing that would give me hope. Absolutely.
Cathy, anything really, really quickly?
Well, I agree. I agree with both our speakers. I think those are great things to hope for. And I would just say, recognizing the impact of it. Sometimes we don't often see the impact, and we just think, kids are acting out, but they're dealing with a lot, especially the folks that are here. So recognizing that sometimes mental health may be at the bottom of all of it. There's some support that could be used. So I think just recognizing, paying attention to it, leaving room for it to be explored.
Thank you so much. So for all of our panelists, thank you so much. Thank you for your highest hope in sharing us. Thank you for sharing your gifts and putting them to use in service of health equity. And a big shout out to my co-task force partner, Beth Maloney, who is CEO of Lumina and is the mastermind behind this podcast. We are grateful for her and her imagination and her team. This will be recorded and it will be available on the website. So again, on behalf of the task force, on behalf of the NIH, thank you so much. And as you all said, here's to our health and our equity. Thank you. Bye-bye.
Thank you, Philippa.